Well, my friends, in many of my videos, I have told and demonstrated about the motor neuron disease. This is once again a patient of motor neuron disease has come from the Darbhanga district of Bihar, has been suffering from motor neuron disease. Upper motor, lower motor neuron disease, I have described many times. See the weakness and the flaccidity of the upper superior extremity. The patient cannot hold or control the ability or power of the superior extremity. And to some extent in inferior extremity. But he can control. He can raise. There is a balance in the right side. So left-sided disturbances, a kind of motor neuron disease. I have told that the motor neuron disease is a slow progressive degeneration of the anterior horn cell and the pyramidal tract in the gray matter of the spinal cord. The cause is generally unknown and leading to profound wasting and paralysis of the affected part, that as I have shown. The disease usually occurs in adults and often starts in the anterior horn cell, supplying the muscles of the hands, causing severe weakness and wasting of the hands. The wasting muscles show typical twitching or tremor known as fasciculation. So there is a fine tremor which is known as fasciculation. So one of the characteristic symptoms of motor neuron disease is known as fasciculation. The pyramidal tracts may be affected in some of the patients or in some cases, leading to a spastic paralysis, usually of the legs. It is characteristic of the disease that no significant sensory changes develop. Respiratory and swallowing difficulties are an usual cause of death in this condition, for which there is only symptomatic treatment in modern medicinal mode of treatment. In homeopathy, we have enough scope because the cause is unknown and it may be considered as some immune disorder of the patient, systemic disorder of the patient. When the cause is unknown, the symptomatology of the patient gives a suitable choice of medicine in homeopathy. Our medicine, Hahnemann's tinctura sine acris cali, is a great medicine in this aspect in motor neuron disease, provided the symptoms should be similar. Other medicines are plumbum metallicum, plumbum iodum, sternum metallicum, zincum metallicum, etc. But always, all the time, the symptoms should be collected and that be matched with the patient. I am showing in my repertory the physical generalities part. I have given the motor neuron disease rubric. I have told you I am going to publish my repertories in many volumes, many smaller volumes. One of the volume I have given the name brain and nerves. So this is a neurological disorder, focal lesions of the nervous system, the brain. So there is a rubric in my repertory, and it is the first time I have given the rubric motor neuron disease. I have given 3 medicines. Later I shall increase the name of the medicines. These 3 medicines given on the basis of my experience of last 50 years. The best medicines are causticum, medurinum and plumbum metallicum. So this patient also required causticum by the symptom similarity, because there is The patient is sympathetic enough. Right-sided complaints, right-sided lesion, words here and there. So, causticum is the choice of medicine, my friends. Let's see the result. How much improvement we may expect from this medicine. Hahnemann's tincture has seen a accurate study for this motor neuron disease. Please remember this video. I shall share you the after effects of this case after 2 months.